Let's start with insemination.
With insemination, yes.
Okay.
Yes, so we have a simple illustration for insemination over here. But to start with, insemination basically means what you're doing is you are getting the man's sperms, you are cleaning them up, concentrating them, and you are putting them into the woman's womb at the time when she has ovulated. This concept is borrowed from animal husbandry.
Oh, yes.
Yeah,
sure.
they do the same. Farmers do the same thing for animals when they are doing breeding of animals. Yes, so we borrowed that from them and we are applying it successfully.
And it works successfully.
It works, yes.
After picking these sperms, doctor, do you first treat them or you just bring them there directly?
No, okay, when you get the sperms, you clean them up. Cleaning is you separate them from the fluid where they are. So we have laboratory techniques which we use for separating the sperms from the fluid where they are being released in. And then there they will be clean. Then in the process, you also activate them because initially the sperms are moving slowly. And so if you take them through the processing, they will be moving strongly and faster.
How long does that take?
The preparation?
Yes.
Maybe an hour or so.
Just
the preparation. So the preparation is an hour. So the whole treatment of insemination, although it is referred to as insemination, it has some preparation first. For example, commonly you start with giving the woman some medication because you want more eggs to grow and you want the eggs to really be released to increase the chance of them conceiving. Yes, and then that takes like about 14 days. So you keep on checking to see that the eggs are growing. And when they are mature and they have been released, that is the day you will get the sperm from the man and prepare it.
So in this case, doctor, when we're using artificial insemination, who could be carrying the problem? Could it be the lady or the man?
So yes.
Or both?
So that's a very good question. For what indication do we use artificial insemination? Artificial insemination, the indication is quite interesting and it has been evolving over time.
Okay.
Sometimes if the couple are unable for some reason not to be together, in the time when the lady could be fertile, we can do that insemination. Maybe the man is abroad and is only coming in December and they want children. So he could leave his sperms here and we do insemination, artificial insemination for the woman. Okay. But artificial insemination is also suitable for a couple where you've done all the tests and there is no problem, but they are not still conceiving after 1 year. Yes, because some of the causes of inability to conceive are not easily identifiable by the tests. For example, it may be a problem in the cervix. The cervix is too tight and it is not allowing the sperms to pass through. Okay. Yeah, so that's one of them. Or if it's a problem of the tubes, but it's a mild one, which can still allow the sperms and the eggs to move around, you can still do insemination. So you increase the number of eggs by a medication, and then you go ahead and do the insemination.
Thank you
insemination has a lot of applications.
A lot of applications and illustrations for us to learn from. But the basics you've given us.
Yes, another thing about insemination which we used to practice a lot, it is now reducing, but I think it might still have to be reintroduced, is discordant couples. HIV discordant couples, where one of the couples is HIV positive, and the other one is not. Because normal sexual intercourse would increase the risk of transmission. And so what we do is we do insemination because we can get the sperm. If the man is the one who is HIV positive, we can get the sperm and through our preparation, and we know how to prepare it if it's HIV sample. Yes. So we are able to remove all the viral particles and prevent transmission of infection. Okay. Yeah, so it used to be quite popular. Yep.
Thank you so much, doctor. Yep. That has been artificial insemination. Insemination. Yes, and it's one of the ways that medics treat infertile couples so that they are able to have a baby.